Morning or night? When do asthma symptoms generally worsen?
Both. Night because of increased inflammation, and early morning because your cortisol levels are low.
The age group you are most concerned about when it comes to missed diagnosis?
More than 40-50 years, because everybody knows asthma is from childhood, but
Childhood.
there is late onset asthma which is very difficult to pick, and if you are not picking, you will not treat it properly and it will increase the mortality.
Mortality rate. Children with asthma should avoid sports. Myth or fact?
Myth. Children with asthma should do sports or physical activity will help in controlling the asthma symptoms. The asthma cases are rising. In India, there are 35 million cases of asthma, which we can say 13% of global burden. But if you see, scaring thing is mortality is even higher. It is 42%. So cases burden is 13%, but mortality is 42%, which is 3 times higher.
Breath is life, and asthma takes control of it without warning. It's not just a childhood disease or a condition or an occasional wheeze. Asthma can flare up at work, at night, or even when you are at rest. Ignoring symptoms can turn simple breathlessness into an emergency. Understanding asthma is the first step to taking your breath back. Joining us today is Dr. Nana Kunjir, who is a highly esteemed pulmonologist with over 20 plus years of clinical experience and more than a decade of specialized expertise in respiratory medicine. Renowned for his diagnostic accuracy and evidence based approach, he excels in managing asthma, COPD, ILD, tuberculosis, and sleep related breathing disorders. His compassionate and patient focused care and emphasis on preventive lung health have earned him deep trust across the Harapsar community. Dr. Kunjir is widely regarded as a dependable and distinguished voice when it comes to pulmonary and chest medicine. Welcoming Dr. Nana Kunjir. Hello and welcome to Sahyadri Health Talks. I'm Dr. Tushita and today we have with us Dr. Nana Kunjir. Hello sir, how are you?
Fine. Hope the same for you.
Definitely. Welcome to Sahyadri Health Talks. And today we are going to talk about asthma. So as we know, asthma is a chronic inflammatory, airway condition, and it's not a disease per se. So how does this inflammation typically affects a patient? Like clinically, what are the symptoms that you see?
As you rightly said, asthma is a chronic inflammatory condition. It affects day-to-day breathing as well as it has a detrimental long-term effect on the lung functions also. So patient may experience variable airway obstruction, means breathing difficulty comes and goes. Patient will have excessive symptoms during night or early morning. In acute episodes, patient will have breathing difficulty. There will be exercise limitations. At night, because of inflammatory bronchospasm, patient will have disturbed sleep also because of this bronchospasm. When coming to the long-term effects, there will be structural or functional. In structural, there will be airway remodeling, like smooth muscles, it will get hypertrophied, means size will increase and it will cause bronchial obstruction. Mucus glands, the size will increase, their production will increase, mucus will become thick and it will block the airways. There will be epithelial damage, subepithelial fibrosis or thickening. So this will cause these structural changes. And coming to the function, there will be decline in the forced expiratory volume, that is FEV1. Hallmark of asthma is airway obstruction, which is variable or reversible. So but what happens now, because of this fibrosis and thickening, this reversibility will go and airway will become fixed. And also the lung function decline will be faster as compared to the other person. So when we see asthma, it is not just a tight airway, it is a chronic inflammation which is active, which is constantly damaging the airways, remodeling the airways. So one has to be comprehensive in treatment so that you can preserve your breathing comfort, and you will prevent the further deterioration in the lung functions.
So, as we see typically in the urban areas, cities like Pune, of course, there has been a rising concern about pollutions and various other environmental factors. So, do you see a rise in cases of late, and what are the key environmental factors that affects asthma?
Definitely, asthma cases are rising. In India, there are 35 million cases of asthma, which we can say 13% of global burden. But if you see, scaring thing is mortality is even higher. It is 42%. So cases burden is 13%, but mortality is 42%, which is 3 times higher. And it's mainly because of massive underdiagnosis. So those who are diagnosed, they are not taking proper treatment. So as you said, ki in urban areas, the asthma cases are increasing. It's because air pollution, there are particulate matter, nitrogen dioxide exposure causing various damages to the lungs. Even urban increase in population, there are cutting of the trees, so green side is coming down. All these things affects the increase in asthma cases. Indoor pollution also plays a major role. There is overcrowding, you can say less ventilation, ACs are not working properly. Smoking, air quality is bad, smoking, passive smoking, and even in urban areas there are pets, that pet dander also affects. So these are the various things which affects
environmental factor. So as you know, there was a common misconception, or I would say a belief, that asthma is typically a childhood condition, or ये बच्चों में होता है ज़्यादा. So is it true, or do we see asthma across different age groups?
You said correctly, asthma starts in early childhood, but it's not like that it will start only in early childhood. We have seen many cases of late onset asthma, and it's really difficult because many times it is misdiagnosed, treated for other conditions. So if you are not properly diagnosing, you will not properly treat it, and patient will have deterioration in the lung function, and eventually there will be a mortality.
Actually, very interesting point this is, and that's where I was coming with my next question, which is, see, when it comes to asthma, the common picturization of it, image which I have in my mind, or for that matter many of us have in our mind, is breathlessness, wheezing, okay, shortness of breath or breathlessness. But the fact is, there are many other respiratory conditions which also mimics similar kind of symptoms, right? So how does one differentiate between कि अच्छा ये शायद asthma है and ये शायद asthma नहीं है, शायद कुछ allergy है? So how do you
rightly pointed out, because like asthma, there are various conditions where there will be breathlessness or chest tightness, like COPD, interstitial lung diseases, chronic
even
bronchitis.
Many form of allergies also, na?
Yeah, definitely. Chronic bronchitis, bronchiectasis, even vocal cord dysfunctions, foreign body ingestion, and even cardiac, and even anxiety, or you can say hyperventilation can also have these things. But the asthma has hallmark thing, the obstruction will be variable and reversible. Reversible on its own or with treatment. Variable means symptoms will vary in intensity over the time. So patient will have more symptoms at night, early morning, or more symptoms when there is exposure to the allergens, cold, or dust, or pollens, like that. When you want to differentiate with the COPD, the onset will be late in elderlies, the obstruction will be progressive and persistent, and there will be history of like smoking or biomass exposure. On the contrary, asthma, it's childhood disease, so onset will be early. This obstruction will be variable and reversible, and there will be history of atopy or allergy or family history of asthma. When you see cardiac things, so heart related breathlessness will be more in lying down position. There will be associated swelling of the legs, and it will not get benefited with the bronchodilators. When you consider anxiety or hyperventilation, there will be breathlessness. When you examine the patient, there will be no signs at all. There will be no wheeze or prolonged expiration. Now coming to the vocal cord dysfunction, patient will have inspiratory stridor, which will not get benefited with the bronchodilator. On the contrary, asthma, there will be expiratory wheeze, and patient will be coming on wheelchair, very breathless, and with the bronchodilator, he will be fine and go running home. So these are the differences. If patient is having recurrent daily productive sputum, then it points more towards the chronic bronchitis or bronchiectasis. Asthma, there will be bilateral signs, but if you are getting only signs on one side or focal signs, then it points towards the foreign body or structural airway damages.
Right. So we have heard about spirometry. Spirometry is believed to be the confirmatory test when it comes to asthma. Tell us more about it.
Spirometry is very important in confirming the asthma, because what happens now, it gives us proper objective lung functions.
Achha.
So in the spirometry, you have to exhale forcefully. So it will tell us how much air you can exhale, how quickly you can exhale, and it will reveal is there any airway obstruction or not.
Achha.
Second thing, spirometry will give us a baseline lung functions
Achha.
with which you can see for the disease progress or whether your treatment is working or not. Even for diagnosis, we can see whether airway obstruction is reversible or not. What we do? We do lung functions pre and post bronchodilator and see for reversibility. If there is 12% increase or 200 ml increase in the FEV1, then it is reversible. And once it is reversible airway obstruction, it strongly suggests asthma.
Okay.
Say as, and also spirometry will help us in differentiating various diseases from asthma like COPD or interstitial lung diseases. Saying all these things, or spirometry is not will not be only test which will confirm the asthma, because we know that if spirometry is positive, then it is definitely asthma. But if spirometry is negative, then it doesn't rule out asthma. As we have already seen, asthma is a variable obstruction. So in between attacks, when asthma is well controlled, the spirometry bound to be normal. When your spirometry is normal, but you are highly suspicious that this patient is having asthma, then we have to go for the further testing like bronchial provocation test, FeNO, which will measure the airway inflammation. There is peak flow measurement, which will tell the variability. And what happens now? In spirometry, you have to exhale very forcefully. And for many subset of people will not be able to do that, like children, adults, or those who are having neuromuscular disorder, they will not be able to forcefully exhale. So in that case, we can take help of IOS, that is impulse oximetry, where patient only have to tidal breathing. So definitely, spirometry is a gold standard. When it is positive, you can confirm that it is asthma. But even if it is negative, we can have clinical diagnosis like symptoms, variability, whether it is there is diurnal variation, where there is a seasonal variation, or whether symptoms increases with the triggers. Or sometimes what we do, if suspicion is there, we are not able to confirm it. We give treatment, and if patient responds to that, then we can say that patient is having asthma.
Okay. So now moving to the treatment aspect of it, right? You must have heard this a million times that सर इनहेलर तो दे दिया आपने, स्टेरॉइड्स है, मैं तो इसकी आदत पड़ जाएगी सर, फिर इसको तो छोड़ना, फिर पूरे लाइफ में लेना पड़ेगा, लाइफ टाइम लेना पड़ेगा स्टेरॉइड्स. So what do you have to say for such patients, and how do you manage such patients?
This is an important aspect, at least when we are sitting in the India. What happens now? Inhaled corticosteroids are very much safe, and it is the most commonly used mode of treatment for long term. We are using this inhaler since 1970. So safety data, we have plenty of safety data, and possibility of having severe adverse effect is very minimal.
What about the dependency, which they are more worried about?
There are, what happens now? Inhaled corticosteroids, when you are taking it, the drug is directly going into the lungs. So where it is actually needed, in the milligrams, in low doses, and there is no systemic absorption. When you see, on the contrary, if you are taking tablets, it will go into the stomach, it will get absorbed, it will go into the whole body, and small part will go into the lungs. So when you are using tablets, you have to use high dosage, and there are high systemic issues also with that. And there is what you said, there is very much misbeliefs and myths, we can say misconceptions, but those are not true. Inhaled corticosteroid will not increase your weight, will not reduce your immunity, you are not more prone to infections, it will not reduce your growth, it will not harm your bone density, and also it is not habit forming. So it's not like you have started and you have to take it lifetime. With proper management, with lifestyle changes, with proper treatment plan, you can stop inhalers definitely.
Achha. So there are two major things which most of us talk about when it comes to any respiratory condition. Most commonly, one is the inhaler, the other one is nebulizers. Another thing which we most commonly hear is that nebulizers are extremely strong. And if your doctor prescribes you a nebulizer, then it's like very worse than condition and all that stuff. So what do you have to say to those patients who believe this?
Inhaler and nebulizer both are same. Both are giving equivalent dose of medicine, same medicine, and having same effect on the disease. So these are two different modalities of drug delivery. Inhalers are very convenient to use. You can use wherever you want, at any time you can use. Another wastage of the medications. Inhalers have less wastage of medications. You know that when you are using nebulizer, half of the medications will go in the air. So having said that, inhalers have some disadvantages also. You should be having proper technique. There should be coordination when you want to use the inhalers. On the contrary, nebulizations, they are easy to use. You just have to sit and inhale. So in certain conditions where we cannot use inhalers, nebulations we should be using, like in children's or elderly people, or when patient is having acute attack of asthma. At that point, it is not feasible to use inhalers. You will not be able to inhale it properly.
Yeah, because there is a technique involved.
Yeah. So in that cases, you can use nebulizations when there is acute attack. And second thing, when patient is having cognitive disabilities or physical impairment, at that point, instead of inhalers, nebulizations will be more helpful.
So when it comes to when a patient undergoes an asthma attack, so what would be a few things that the patient and of course the caregiver, the family who are there with the patient should first take care of before taking the patient, bringing the patient to the hospital? What are the few things that you want the family to be extremely careful about when the patient is undergoing an asthma attack?
So when patient is having asthma attack, so one should be vigilant enough to pick up the red flag signs.
That's
What
right.
happens now? If you pick up it properly, then you can treat it properly and prevent the mortality. So red flag signs will be like patient will be breathing very heavily, will not be able to talk in sentences. Patient will having high respiratory rate. There will be chest tightness. The chest indrawing will be there. There will be constriction in the chest. Patient will have blue lips, blue fingers, that is called as cyanosis. Patient, there will be increased mental disturbances, or there will be confusion, or patient may become drowsy, or sometimes what happens, patient is gasping for the air. The first thing you should immediately do is give rescue medications to him, so it will little be helpful. Call for the help, call your doctor, call for the ambulance. And meanwhile, what you can do is ask patient to stay calm, breathe slowly, because what happens, patient becomes panic, he will breathe fast and it will worsen the condition. Make him sit upright, slightly leaning forward. Don't make him lie down, so it will
Don't make him lie down.
it will worsen the condition.
So these will be a few things that, primarily don't make him lie down, and kind of free away the surrounding areas, ask the patient to breathe
And
slowly.
what you can do is, sometimes the clothes will be tight now. So what you can do
If
is
there are
just
any tight clothes or anything,
release
remove
it, so that tightness over the neck or chest will be reduced.
So before we move on to the next segment of this podcast, my last question to you would be that in this winter, what tips do you have for all the patients who are, who have this asthma, and with regards to their lifestyle, exercise, or especially traveling, because winters also is a season where people travel a lot. So what tips do you have for them?
So during risky seasons like winter, so what, with a slight modification in day-to-day activities, you can prevent the asthma attacks. Like while doing exercise, if you are doing 10 to 15 minutes warm up, your airways will get time to adapt. When there is high pollution or high pollen burden, at that time go for the low physical activity. Don't do intense exercises. When there is air quality outside is very bad, stay indoor, do exercise inside the house only. And
so what about the traveling part? What precautions should they take when it comes to the traveling?
so when you want to travel, what I suggest ki, whatever your destinations, just have some idea about how is the air quality there, pollen burden, how much it is there, so that we will be well prepared. Have extra medicines in your baggage. Keep your rescue inhaler handy. And while traveling, use your mask. When you are going into the four-wheeler, keep windows closed. That is the most important
So
thing
these
while
basic
traveling.
things should help. Okay.
Another things, uh, to prevent, what happens now, When there is exposure to the allergens, then there will be exacerbation. So pertaining to that, there are various allergens like dust mite, pollens, pet, or molds. So dust mites mainly we get it in the bedrooms. So what we have to do, we have to clean your bed sheets regularly. You can have the dust mite free mattresses or pillow covers. If you have any carpet at home, just remove the carpet, because carpet is a large source of dust mites. You will not able to see also. Coming to pet, we know that it is always advisable to remove the pet, but sometimes it may not be possible because of your emotional attachment. So at least may keep them outside. Use HEPA filters inside and wash them regularly. So keep them clean. About molds, wherever there is leakage, you have to fix it properly. Keep home clean so that mold exposure will not be there. And pollens, when there is pollen season, don't go outside. Even if you want to go outside, use protection. And when you come inside home, when there is pollens outside, so better to have a shower and change the clothes.
So, sir, help us understand a few warning signs of asthma.
You mean early
Yeah,
signs?
early warning
Many times what
signs.
happens na, in India, people forget or overlook these signs. But if you are properly aware of it, so you can promptly diagnose asthma and take proper treatment. So signs will be wheezing, that is whistling sound like during expiration. If you so this is wheezing. Second, there will be chest tightness. You will feel heavy in the chest. You will have repeated cough, cold with in which is more at night, early morning, or exposure to particular things like strong smell. And you will have repeated respiratory infections which last longer than common people. Then you should think ki you should get evaluated for asthma.
So that's about that. And now moving on to the next segment of our, podcast, which is I ask you a few questions, and you have to give me very quick and crisp answers. These might be a few myths or fact questions also. So if it is a myth, then you'll have to give us an explanation about why it is a myth, and if it is a fact, then also we need an explanation to that. Okay, one symptom of asthma that people most commonly ignore.
Definitely cough. What happens now? Patients say that I'm just normally coughing. It's not like that. If you are having cough, repeated cough, which increases with the triggers, then definitely it may be asthma.
Okay. Most powerful non-medication tools for asthma control.
Identifying and avoiding triggers. Along with that, pranayam, breathing exercise to strengthen your lungs.
Okay. The biggest mistake patients make during an asthma attack.
The most common mistake is patient becomes panic, he breathes rapidly and it worsens the condition. Patient should stay calm and breathe slowly, so it will help in controlling the asthma.
So rapid breathing does not help.
Definitely.
Slow breathing
will
helps you control the situation
At least
better.
It will not worsen the condition.
Okay. One environmental trigger you wish people took more seriously.
Indoor air quality, because people are well aware about the outdoor things,
So
but
they wear
indoor
mask and everything.
Yeah, but indoor they are not aware at all.
Okay. The safest inhaler type for long-term use.
Undoubtedly, inhale corticosteroids. We have plenty of safety data, and chances of severe side effects are less or
Bare
minimal.
minimum. Okay. One test every suspected asthma patient should definitely do.
Spirometry. So it will give us idea about the lung functions, whether it is reversible or not.
Peak flow meter, underused or overrated?
In India, peak flow meter definitely underused, because if you are using it peak flow regularly, decline in the peak flow will be much earlier than the symptoms. So you will pick exacerbation early and you will prevent the exacerbation.
Okay. One habit asthma patients should avoid at all costs.
Smoking. Smoking is the worst thing
that
you can do to your
lungs if you have asthma. Low. Okay. The age group you are most concerned about when it comes to missed diagnosis.
More than 40-50 years, because everybody knows asthma is from childhood. But there is late onset asthma which is very difficult to pick, and if you are not picking, you will not treat it properly and it will increase the mortality
rate. Okay. Nebulizers are stronger than inhalers. Myth or fact?
No, nebulizers and inhalers are same thing, only different modes of delivery, and both acts at same with same strength.
Okay. Children with asthma should avoid sports. Myth or fact?
Myth. Children with asthma should do sports or physical activity will help in controlling the asthma symptoms.
Okay. Asthma disappears as children grow older.
It's partially correct because what happens 30 to 50% cases in adulthood or adolescence, asthma symptoms will get controlled. We may feel that it has been cured. No, asthma will not get cured. In adulthood, there are chances if you are not taking proper precautions, it will reappear.
Steroid inhalers causes long-term side effects.
No, steroids are most safe or mostly commonly used long-term medications in the respiratory medicine. So they are safe.
Achha. Asthma only flares with dust or pollution.
No, asthma fares with dust and pollution. But apart from that, there are many things like cold air, pet, even exercise can exacerbate the asthma.
Okay. So that's about asthma, some rapid fire questions and some myth busters. So before we let you go, what would be a final message you want to give out to all our viewers who are, living with asthma, and what are the tips that you want to give out to them?
Asthma is very good disease because it is totally reversible. It's up to your hand. If you are taking precautions, taking medications, then you can live your life fully, means without symptoms, without medications, and you can perform more than 100% of your capability. So rest assured, take proper precautions, have some changes in the lifestyle, and your asthma will be well controlled. You can breathe very properly or comfortably, and you can live normal life.
So there is nothing to be worried about. Just
Definitely.
follow the instructions given by the doctor, and asthma is just manageable.
Yeah, one last thing, if you have some deterioration like cold or viral, then definitely reach out to your pulmonologist, because once it increases or there is exacerbation, then it will affect you very badly. If you take proper treatment and prevent exacerbation, it will be helpful in the long term.
Okay. On that note, thank you so much for giving us some time today. It was wonderful having this discussion with you,
Same
and we
here.
got to know so many things about asthma, and we also have busted so many myths about asthma. Thank you so much once again.
Thank you very much.
On that note, this is Dr. Tushita signing off, Sahyadri Health Talks.